going to talk about the HPV vaccine. Now, before talking about the vaccine, let's discuss a little about the human papilloma virus. Now, papilloma virus, that means it comes from the family of Papillomaviridae. Now, the easiest way to remember this virus is puppy. So, we have this cute little puppy, which is a naked African puppy. Now, why is it that we're talking about the naked African puppy? Is because it is a non-enveloped virus, and since it's a puppy, so it will have double-stranded DNA. And why African? Because the maximum prevalence of this HPV virus is in sub-Saharan Africa, which is somewhere around 24%. So that is the reason that the easiest way to remember this virus is a naked African puppy. Now, this puppy lives in this beautiful purple colored capsule. So that symbolizes the capsid of the human papilloma virus. And this capsule in which the puppy lives has got two bulbs, L1, two lights, L1 and L2. Now, L1 is the major light and L2 is the minor one. So these symbolize the structural proteins which are present in the capsid of the human papilloma virus. Now, of these two structural proteins, the L1, which is the major structural protein or the major light in the capsule of this puppy, this is the most important protein because this is what is needed for the preparation of the human papillomavirus vaccine. Now, this puppy is a very naughty puppy because it goes all over, goes onto the skin, onto the mucous membrane. It has this habit of licking everywhere. Very, very naughty puppy. That means the human papillomavirus affects the skin as well as the mucosa. Why is it so important to know about this virus? Because 12% of the women with normal cervical findings are infected by this virus. So that is a very good number. So this is the worldwide prevalence of the human papillomavirus in women with normal cervical findings. So this is what we need to know about the structure of the human papillomavirus. Now, if we talk about the vaccine, which is so important to prevent the pre-malignant conditions in women for the cervical cancer, this light of the capsule, that is the L1 major structural protein, is used for preparation of the vaccine. Now, this protein has a very beautiful property that it assembles itself into virus-like particles or VLPs. Now, as you can see, these virus-like particles do not have a DNA, so they are not infective, but they are immunogenic, and this is what we need for vaccination. So 0.5 ml of this vaccine, which contains the L1 major structural protein of the virus, is given IM in the deltoid of these beautiful, cute little 9 to 14 years old children. Now, this is the age group which is recommended by WHO, and it is very easy to understand that this is the time which is the time when children are not exposed sexually. So this vaccine aims and targets the population before the first sexual exposure. Now, how is the immunogenicity elicited? It is like the L1 or the virus-like protein particle. It lives in the lymph nodes and it elicits a strong humoral reaction in these areas. And in the lymph node, it stays there for years. So that is how the immunogenicity of the virus acts. Now, why is it that we are giving it to both girls and boys? Because this human papilloma virus can cause head neck, oropharyngeal, anus, and penile cancers as well, and also certain benign conditions like anogenital warts and recurrent respiratory papillomatosis. In girls, apart from cervix, it can also cause vaginal and vulval cancers. So, that is the reason why we give this vaccine to both boys and girls. Now, if we talk about the types of vaccines, majorly we have three types. The first one is the Cervarix, which uses the most naughty, that is the HPV 16. The most naughty HPV 16, which is also the most common, and HPV 18. These are the two high risk viruses, strains, which are included in Cervarix. Now, if we talk about Gardasil, Gardasil uses 1, 2, 3, 4 strains, of which 16 and 18 are high risk for malignancies, and 6 and 11 mostly are risk factors for the warts. So 6, 11, 16, 18 present in Gardasil not only protects the patient from pre-malignant cervical cancer lesions but also from anogenital warts. Then we come to the solar system of Gardasil 9, because it has 9 strains, of which 6, 11, 16, 18 is there. It's very easy to remember 16 because it is the age of consent, and 18, which is the age to vote. Apart from that, the other strains are very easy to remember, like nowadays girls get married by 31, 33. They have maximum time to have kids is by 45, and then 52 and 58 is the time to have grandchildren. So Gardasil 9, the solar system, has these 9 strains of the HPV virus. Now, the type of virus which is to be chosen, it depends upon the relevant data on HPV associated public health in that particular area where we are going to vaccinate. So depending on your area, you will choose the virus and you will choose the particular type of vaccine which is to be given. Now, doses, WHO recommends 2 doses, minimum 6 months apart, but maximally there is no limit stated. You can give it at an interval of 6 months, 12 months, 2 years, 3 years, 5 years. Anything is allowed, but a minimum of 6 months gap between the 2 doses is recommended. Now, coming on to special considerations for the HPV vaccine. It is allowed in breastfeeding women but not in pregnant mothers. Now, a special category of sexually abused children in the advised age group 9 to 14 and HIV positive people, is these two are the priority list. They should be covered with the HPV vaccine. For HIV individuals, if possible, 3 doses should be given, but at least 2 should be given. Now, there are very few small things of co-administration. That is, this vaccine can be co-administered with DPT, meningococcal conjugate vaccine, and when given, this vaccine can also give cross protection from other strains which are not covered in the list of the strains in that particular vaccine. So cross protection from other strains is also there. And suppose you take a particular type of vaccine and then you forget what was the type which was given, and 6 months later you are at some different place. In that case, you can take any type of vaccine, whatever is available in that particular area. So this is all about the HPV vaccine. I hope you like it. It's very easy to remember through this pictorial mnemonic. Any questions? I'm free to answer. Thank you.